So I'm recording this on November the 19th, Sunday, 2023. So in the news recently, there have been a few articles about this new mystery respiratory dog illness that can be fatal. It's happening in the Pacific Northwest, the Midwest, the Northeast, everywhere. And a few different articles, they've interviewed expert veterinarians and specialists, and they don't know what it is. They don't know how to test for it. They don't know. So they say what they do know is it doesn't seem to respond to antibiotics, which means it's probably not bacterial, it's probably something else. Okay, they don't know how to test for it because they don't know what it is. But all they can really recommend is stay up to date on vaccines and isolation to prevent contagion if it's a contagious disease. So let's just stop right there and talk about how much sense those things make. Let's think about that logically. So if they don't know what it is and they don't know how to test for it, then they don't have a vaccine for it. The vaccines they have for upper respiratory disease are like Bordetella or kennel cough, parainfluenza, flu, there's one or two others, but they know what those are. They know how to test for them because they have vaccines for them. They know all about them. It's not any of those things because they've tested for those things. They don't know what it is. So the recommendation to stay up to date on vaccines doesn't make any sense because whatever this new thing is, it's not in the vaccines, okay? The second recommendation they have for us is isolation. Well, how'd that work out for us last time? March 2020, how did social isolation work in the world? Do you remember that? Dogs need social interaction the same way that little kids and the elderly in nursing homes need it. So isolation is not the answer either. So it's a mystery. It's a mystery illness. They don't know what it is. Well, it shouldn't be a mystery. It's not a mystery to a lot of us. It's just a mystery to the Western medicine modern system that veterinarians are part of. But it's no mystery. It's the same thing that's been plaguing our entire planet for 4 years. It started in December, November of 2019, and it really hit the USA in March of 2020 with COVID. It's still that. That's what this mystery is still that. And even that's a mystery, but it's still the same thing, okay? What's happened in that time is we've put a whole new rollout of an electromagnetic communication into the atmosphere. That's the new cell phone technology that everybody knows of. We're also, a lot of people don't know, we're pumping a whole lot more satellites into the atmosphere for the same cell phone and wireless rural internet. And that's just messing up the electrical balance of the earth. And that's why everybody's sick. That's why we keep getting new variants and waves of COVID as more and more of this technology gets put into use in city streets and intersections and towns and hospitals and colleges and schools and everywhere. We keep getting more rollouts of different versions of this disease because it's still trying to do the same thing. It's still trying to help us adapt to all this new electromagnetic energy and radiation. So, and that's what's happening in the dogs. It's the same thing. Another interesting thing on YouTube, Dr. John Campbell is pretty popular on YouTube. He just posted a video a few days ago about increased rate of deaths in the past 3 or 4 years. So when COVID first came on the scene, there was an increase in deaths from COVID. So yeah, we know that. But since then, death rates from heart issues, and I don't mean congestive heart failure for chronic heart disease. I mean heart attacks in young people that you've heard of. You've heard of these things, pilots and young, healthy people and athletes. Deaths like that are still up 20% more than they were before COVID times, which was before we introduced this new cell phone technology. So that's interesting. He's got a video about that just from a few days ago. Respiratory disease and heart disease that's not related to elderly heart failure is still 20% higher than it was before this all started 4 years ago. If you want to know more about that, and I strongly recommend you look into it and read it, cellphonetaskforce.org is the place to go to find all this information, and I'll put a link in the notes. Thanks.